So hello everyone, I'm Sophie, and I'm going to speak about my experience with ALL today. So I thought there's no better way to start off by telling you about this than by going right back to the beginning, where it all started 5 years ago. Next slide, please. So 5 years ago this month, I had begun experiencing some symptoms that I didn't really realise were anything to worry about at the time. Initially, I just started having some quite bad headaches and a little bit of neck pain as well. And in the beginning, I kind of just put it down to sleeping a bit funny, maybe, or being a bit stressed. I was only 20 at the time and I'd just finished my second year of university. So I thought, it's probably exam stress and things like that. So I kind of just plodded on for a little while until I spoke to my mom about it, and she sort of said, yeah, you should probably get an appointment with the GP. So I was like, oh, okay, we'll do that. So anyway, I popped off to see my GP, and he was just a little bit confused, really. I sort of spoke him through my symptoms, and he was asking me, are you feeling okay? Do you feel warm or anything like that? And I was like, no, I'm fine. I just expected him to just send me home with perhaps some stronger painkillers or something like that. But he initially said to me that he was a bit worried about this neck pain that I had, mainly because of meningitis, because of being a student and things like that, and my age as well. So he actually told me to get myself down to A&E. And at the time, I was actually a bit put out by that. I didn't expect that there was going to be anything wrong. I just thought, I'm going to be sitting in A&E for a good few hours now. But again, you just sort of go with the flow, and I went down with my parents. And then we were seen straight away. And I always remember this nurse doing my observations, and he looked very concerned looking at the screen behind me. And I just thought I don't really understand why he's looking so worried. And they swiftly moved me around to majors, actually, in A&E, mainly because they were concerned about I had quite a high temperature and also quite a fast heart rate. But again, at the time, I felt absolutely fine. So I just kind of didn't really know what was going on at that point. And then a couple of hours later, I was told that I needed a blood test. I'd never even had a blood test before, so I was quite upset about that. And then they moved me up to a ward, and I was told that it didn't necessarily mean that I was staying in. It just meant that the doctor wanted to come and speak to me about something. So I said, oh, okay, that's fine. And then they came up, and the doctor looked at me and he said, oh, I'm going to need a few more blood tests from you. And I was like, well, why? And he said that one of my blood counts was quite abnormal, specifically my eosinophils. And initially he said it could have been the sign of a parasitic infection or something like that. And yeah, they just had no idea what it could have been. So I was kept in overnight, and then the next day I had a few tests done. So I had a bone marrow biopsy and also a full body scan and things like that. Next slide, please. Yeah, so within a couple of days, they got the results of that bone marrow biopsy back. And the doctor who actually gave me my diagnosis of ALL pretty much had his head in his hands and told me that he went down to the lab himself to look at the slides because he didn't believe that that's what it could have been. My presentation was very rare with the eosinophilia. It's, from what I know now, it's less than 1% of cases of ALL. So they transferred me pretty quickly from my local hospital to a more specialised centre in the middle of Birmingham, where they had a teenage cancer trust unit. Because of my age, they said that I'd be, better treated there. I mean, it would suit my needs better. And as you can see on that photo, it was a lot different than a normal adult ward, which was very nice to be in that situation. So yeah, they started treatment straight away. I was enrolled immediately onto the UK ALL 2011 trial and began the induction therapy very quickly. But unfortunately, I did actually fail the induction for that very fast. So after 28 days, when they did the biopsy, they found that I hadn't really had much of a response to it. So that was then when they decided to go on to a few more intensive protocols for me. So I was on NoFo-B and NoFo-C were the protocols. So on that other photo there, that was me with my 24-hour bag of methotrexate, which wasn't very fun. Next slide, please. So yeah, initially I didn't really have any side effects with the treatment. I tolerated it quite well. As the intensity increased, that was when I perhaps started experiencing a little bit more nausea, and began with a little bit of mucositis, but nothing really unbearable at that time. But as we progressed through those 2 treatment protocols, I still wasn't really responding well enough, or as well as they would have wanted me to at that stage. So that was then when they suggested that I'd probably have to go down the transplant route. So all of that was explained to me, and I was admitted at the end of October in 2018 to begin the conditioning treatment for that. And I think pretty much from the first time that I had total body radiation, I was completely not sick. It really had a massive impact on my, gastro system. So I was very sick, which then led to a lot of weight loss. I couldn't eat a lot because of quite severe mucositis. I had a lot of bleeding and nosebleeds, things like that. So yeah, it was a really tough time during transplant, and that did have an impact on my recovery. Next slide, please. So thankfully, I did get a lot of support from my clinical team whilst I was going through that. We had to go through a very long list of anti-sickness medications to find something that worked. So it was a lot of trial and error. So eventually we did find something that got it under control. But of course, I'd already lost a lot of weight by then. So we had to sort of support my nutrition with some like fortified drinks and things like that to help me keep everything down. And I also had to have quite a few blood and platelet transfusions, especially whilst I was an inpatient, again, just to support with the side effects from all of the conditioning treatments and things like that. And I did eventually have to have a morphine driver too, and that was to help with the mucositis because it did get quite painful, but it was well managed, thankfully. Next slide, please. Now, after my transplant, I didn't really have an easy time. So between the actual date of the transplant and the 100 days after for the next bone marrow biopsy, I didn't realise that my symptoms had started coming back. And I don't know why I didn't really notice at the time. Maybe I was just, trying to ignore the fact that it could be happening again. And I had my day 100 biopsy, and I was sent another letter 2 weeks later to say that I needed to have another one done. And I had a couple of friends who were going through transplant at the same time as well. And I remember asking them, have any of you been told that you need to go for another one? And they were just like, no. And I was like, oh, okay. Tried not to think a lot of it. But then when those results came back, it was the same situation again. The leukemia had come back, and there were quite few treatment options left at that point. So this was April 2019, so very soon after my transplant in November. And I remember looking at my consultant and saying okay, chemo then. And he was like, no, I don't think that's going to do the job this time. And I was like, oh, okay. That's when I knew it was really serious. And so we spoke about, perhaps doing a donor lymphocyte infusion. They still had some cells left over from my transplant, but I was advised that it probably wouldn't do a lot, and it would possibly just give me quite bad GVHD and make me quite unwell. And then, of course, the other option was CAR-T therapy. And at that point, my treatment centre were very close to being signed off as a CAR-T centre, but they weren't quite at that moment. And I also didn't quite meet the eligibility criteria either at that point. Weirdly, my relapse wasn't showing in the flow cytometry, so they had to do another one there and then to confirm that. Next slide, please. So I had that bone marrow biopsy done, and then when those results came back in, it was shown that there was a relapse in the flow. So they told me that I could go ahead with CAR-T, and very thankfully my treatment centre did get signed off to become a CAR-T delivery centre. So I was able to have my treatment close to home, which I know a lot of people aren't privileged to be able to do, because their treatments are quite few and far apart. But there are more now, which is good. So that all happened quite quickly. My cells were collected during April, and then manufactured over the month of May. And then I was admitted to hospital again to start the conditioning and to go through the process, actually on my 21st birthday, which was quite ironic. So they put me back in hospital and we went through all of that. And initially it was quite scary because I couldn't find anyone my age who had had that treatment at that point in time, because it was so new. So it was quite scary, and I didn't really have anyone to talk to about what to expect. But I was very pleasantly surprised with my experience, because I had far fewer side effects than I had with my transplant. We just had some sort of, mild, well, I say mild, it was quite low. My blood pressure went quite low, and they had to send me to intensive care just to be monitored for 24 hours. But it was, it was nothing in comparison to what I'd already been through. And it was pretty textbook, the way that things happened, or the way that they explained it would happen. I followed everything that they said. They said usually, admitted and then discharged after 11 days, and I was. And then I was managed in my local clinic after that with the treatment centre, and had to have some supportive therapy and things like that. But again, it was so much easier than my transplant was, which I was really thankful for. And then it was the same process of having a biopsy done after 28 days to see how things were going. And that did show that I was in complete and full remission after my CAR-T therapy, which was just amazing to hear after going through so much in that year. Next slide, please. So after that, within 3 months, I went back to university, and I carried on, finished my degree, which was in biology. And I remember when that photo in the corner was taken, actually, I went to see one of the blood sciences teachers, and I said to her, like, this is what's happened. I really want to do my dissertation on leukemia. Can you take me on as one of your students? And she kind of sat back in her chair and she was like, you do realise like how crazy that is, that you did that. You were in hospital 3 months ago and now you're just sitting here asking me to do this. And I was like what? Like, no, like I'm just excited to be here. And I don't think I'd even really processed what had happened at that point. But yeah, so I went on to complete my degree, and then I did a master's as well in haematology, which I graduated from last year. And after graduating, pretty much, I think it was the day after I handed in my dissertation, actually, I had an interview with Leukemia Care, who are a blood cancer and leukemia charity in the UK. And I now work with them as their advocacy officer, which is amazing, because I always said from the moment all of this happened that I always wanted to be in a position where I could, speak to other people who are going through this and to help and support where I can. And so now I do get to do that, which is amazing. So yeah, that's a little snapshot of everything that I've been through. But thank you all for listening, and it's just really nice to be here. Thank you.